Hey everyone, Dr. Charlie Johnson, physical therapist. Wanted to create a short video to share with you a little bit about back and leg pain. So if you're watching this video, often we'll see people come into the clinic and they will say that their hamstring feels really tight or feel like they pulled a muscle in the back of the leg. Sometimes they've injured their back maybe a couple days before, and then what began as stiffness kind of creeps up and becomes stiffness in the back of the leg or pain, and sometimes even numbness tingling down the leg. Sometimes people are running or just stretch their hamstrings in a weird way and they feel as though they have hamstring pain, but when they stretch the hamstrings, or at least that's what they think it is, it just gets worse. So I'm going to help you determine today using a simple test called the SLUMP test, whether or not the stiffness that you feel down the back of your leg is due to a muscle that you pulled and or a nerve that's irritated. So here it is. It's called the SLUMP test. You're going to go home. Let's just say you have pain in the back of the right leg or the back of the right thigh. What you're going to do is you're going to sit on the edge of the bed and you're going to put your arms behind your back and you're going to slouch everything. Now you're going to do this test. Again, if you have pain in the right leg, you're going to do it on the good leg first so you can see how far you can go and what it feels like, okay? So at home, what I want you to do is slouch everything down, really poor posture, chin to the chest. And on your left leg, because that's your good leg, let's just say, you're going to pull your toes up, okay, and pull your ankle up towards the ceiling and slowly straighten the leg. And you're going to see how far you can go, and you're going to get an idea of what it feels like, okay? So then you're going to lower that down. And then what you're going to do, okay, is you're going to do it on the painful side, in this case, the right leg. And you're going to slowly pull the toes up again, okay? And you're going to see how far you can go, okay? Now, what you'll often notice is that maybe you can't go as far with that leg because you feel a buildup of stiffness or tension in the back of the leg, okay? But what I want you to do is when you get to that point where you feel the stiffness, okay, everything's still slumped, is go ahead and don't move anything, feel the stiffness, don't move anything but the head. So just look the head up and don't change anything else. If, when you look the head up, all of the pain in the back of the thigh goes away, okay, that's an indicator that a nerve in the back of that leg is irritated, right? So I didn't move anything, it didn't change anything in the leg. The only thing I did was lift the head and change the head position, and it changed the symptoms in the back of my leg. So if you're doing this test and you're wondering, hey, what's going on? I have stiffness in the back of my leg, and I think I just pulled a hamstring, maybe think again. Try this test out. If you move your head and your pain in your back, your leg goes away, it's definitely not the muscle, it is a nerve that you've irritated. So, again, if this is a positive test for you, you can email me directly at charliejohnsondpt@gmail.com if you have any other questions.